Kathy Watson Physiotherapy here. I wanted to talk with you today about the knees and how I know a lot of people are super familiar with knees that hyperextend, they're stretched too far back. It's not so good for the knee ligaments, it gets them all stretched out. Plus it can cause problems up at the hip, further up the chain, as well as down in the feet. So if we're going to look at the knees today and do a little correction, Sarah's here demoing, and you notice with her legs, they're not only hyperextended, pushed too far backwards, but they're actually starting to bow. So the knees are starting to move outwards a little bit. So we want to help her correct that. So if she was to say try to correct maybe all on her own without any other knowledge, she might overcorrect. So an overcorrection would be too much bending of the knee. So go ahead and bend too much. Sometimes people will try to do this thinking this is better, I'm supposed to have bent knees. You don't want bent knees though, that can cause other problems. We want soft knees. So you can play with that and find it on yourself. If I'm fully extended, I'm just going to come forward just a little bit to have a bit of softness in the knees. And if you have also that little bit of bowing of the knees away from each other, you can think about getting a little bit more, tiny bit more pressure maybe around the outsides of the foot to try to get this side of the leg revved up a little bit for muscles to bring the legs inwards a little bit. So try that at home. And if you want to take pictures too, it's always handy. Have somebody take pictures of you and then you can see what your change looks like on the picture.